morning, everyone, and thanks so much for joining us here on KXAN Live. I'm Will Dupree in the KXAN Live studio. We thank you for joining us today, and we hope you're having a good Thursday. In just a few moments, Texas State University and several of its administrators will hold a news conference virtually, of course, because of the ongoing pandemic, to talk about how that health challenge is affecting the upcoming fall semester. We're going to hear from three different officials. They're going to be discussing everything from how classes are going to be held during the pandemic to what campus life will look like, as well as what health protocols are going to be in place related to the pandemic. So again, you're going to hear from those three officials here in just a moment. We're going to listen in as this news conference gets started virtually from Texas State University.
We'll try and keep this brief and to the point. Our speakers today are Jean Bourgeois, Provost and Vice President for Academic Affairs, Cynthia Hernandez, Vice President for Student Affairs. Hang on just a moment.
Recording in progress.
Okay. Let me start again. Our speakers today are Jean Bourgeois, Provost and Vice President for Academic Affairs, Cynthia Hernandez, Vice President for Student Affairs, and Dr. Emilio Carranco, Director of the Student Health Center here at Texas State University. Each one will give a brief overview of preparations and plans and procedures in their areas of expertise. And then once all three have given their presentations, we will open the floor to questions and comments from the media. And I would like to begin by yielding the floor to Dr. Bourgeois. Jean, take it away.
All right, well, thank you, Jamie, and thank you all for joining us this morning. So I think, and I don't know if you all have had a chance to review any of the official kind of university announcements that include a series of emails that either President Trouth or I or Dr. Carranco or Dr. Hernandez have sent out to our various constituencies and the public. But you know, my comments are really in line with what we've already put out, which is the fact that we have long been preparing for a beginning of a semester, a fall semester at Texas State University, to have basically a very robust in-person experience for our students in the classrooms and outside of the classrooms in their co- and extracurricular activities. This obviously also extends to various support services that will be offered to our students and others. And so we've been diligent in preparing for a safe return of our faculty, staff, and students for this beginning of the fall semester. Per those plans, directions have been sent out to the academic units that we do expect them, that is the faculty, to offer the classes as they have been scheduled in our Texas State schedule of classes, so that roughly 87% of the classes will have a face-to-face component, and about 13% will be online. That includes the former. That includes the ability by faculty to go online or to have a Zoom session or 2 or 3 during the semester at their discretion. Faculty have actually always had that authority or that ability, that prerogative to meet some of their classes each semester in a face-to-face format, actually not in a face-to-face format. That is roughly out of the 45 contact hours in class each semester, at least 39 of those contact hours must be done in person. And so faculty historically have possibly Zoomed a class, or they've had students do assignments without actually being in person in that class. So in that respect, actually, I think Texas State University has afforded faculty the flexibility of figuring out how they want to start this semester, or how they wish to maybe start the semester and then after 1 or 2 or 3 weeks decide that they want to pivot and do something a little bit differently for the 3rd or 4th week. That's their choice and their discretion. The university is continuing to do and follow certain safety protocols and procedures, including the fact that we're doing viral spraying in our classrooms and heavy use facilities. And you know, that's a comfort, I think, not only to our faculty and staff, but our students, that the viral sprays are designed actually to try to mitigate, obviously, the spread of COVID-19 and the Delta variant through surface transmissions, even though we all know that the research shows that's primarily not how that is spread. Our facilities group have done a very good job of optimizing airflow in all of our buildings. So in those respects, we think we're ready. Everything is in shape for a 100% capacity for classes, buses, and other venues, events, and meetings. And Dr. Karanko will speak to more of those health and safety reasons or justifications for starting in this fashion. But myself, President Trouth, and the rest of the cabinet feel pretty secure in knowing that we've done everything we can do to offer our students, faculty, and staff a pretty safe beginning to this fall 2021 semester. So Jamie, I think that would be it for my beginning statement.
Okay, thank you, Gene. Dr. Hernandez, would you like to speak next?
Sure, I think that Dr. Bourgeois spoke to a lot of things that we were doing. Obviously, with in-person classes, we're also returning to in-person activities in our co-curricular and extracurricular spaces as well. I will say we made a decision last week to have all students who were checking into on-campus housing show proof of a negative test. We also had some rapid testing on site so that we were able to verify that. We had roughly about 6,000 students check in, and a majority of those had proof of their negative test. Out of that 6,000, we tested close to 1,468 tests at our rapid testing site with only 16 positives. So if we think about the 6,000 that checked in and only 16 positives, we have about 0.2% of our students were infected that were coming in. And students who either tested at home or tested positive here have been asked to isolate and quarantine at home before returning to campus, or isolate at home before returning to campus. And we're working with them on their housing contracts so that they're able to come back into our community once the isolation period has passed. And so we felt good about those numbers. It was a good check-in process. And the students are really excited to be here. They're starting their Bobcat preview, which is our welcome week here at Texas State, and been seeing some good engagement in those activities as well. And so I'll pause there and turn it over to Dr. Karanko for his comments.
Dr. Karanko, as Assistant Vice President for Student Affairs, Chief Medical Officer, and Director of the Student Health Center. Dr. Karanko, you have the floor, sir. I believe you're muted.
Okay, good morning, everybody. I think the question that many are asking right now is, can we provide a safe learning environment for our students? And I think that the answer to that is yes. When we started planning for our COVID-19 response early last year, I think one of the strategies was to develop a university webpage where we could provide a lot of information for our faculty, staff, and students to help them navigate the pandemic and to be able to come to school and to work as safely as possible. We call that webpage the roadmap. In that roadmap is also a set of 12 health and safety guidelines that we developed. And those health and safety guidelines were developed to help folks be safe while they were on our campus. And those health and safety guidelines included things such as wearing face masks indoors, physical distancing, COVID testing, daily self-assessments, reporting to Bobcat Trace so that we could initiate contact tracing, staying home if you're sick, hand washing, covering coughs and sneezes, enhanced cleaning and disinfection, physical barriers wherever there were locations with a lot of interaction with the public, optimizing ventilation and vaccination. And I can report that using those 12 health and safety measures was very successful for us. We were able to have in-person teaching last fall and spring without any outbreaks on our campus. So we know you can do it. And that was even before vaccinations came on the scene. We didn't have access to vaccinations until March. And so for the most part, the fall and the spring were conducted without that additional safety measure. And we were successful in being able to provide a safe learning environment. And so as we prepare for this fall semester, our plan is to continue using those 12 health and safety measures, but we're going to emphasize 4 of them. And that's because we're in the middle of a surge, and we feel like there are certain health and safety measures that we need to focus on, measures that we believe will provide the most impact in terms of preventing infection and preventing the spread of infection on our campuses. So we're going to be emphasizing vaccination. Ever since we began vaccinating back in March, we've been heavily promoting vaccination to everyone in our university community. We know that vaccines are safe, they're effective. We've not seen any long-term consequences. And they're our best opportunity for protecting ourselves and for protecting others as well. We're going to really promote the wearing of face masks indoors and outdoors in crowded settings. We know face masks are very effective in preventing the spread of COVID-19. Face masks were one of our primary safety measures during the fall and spring of the last academic session. We're going to talk about more frequent COVID-19 testing. We know that up to 40% of those infected may be asymptomatic, so they're infected and don't even know it. We know that even some people who are vaccinated can develop an infection and can spread that infection. And for all of those reasons, we think that screening for COVID-19 is really important. So we instructed our faculty, staff, and students to test 2 weeks before the start of the fall semester. And then we came back and instructed them to test again right before the start of the fall semester. And then in addition to that, to ensure that we had really safe living environments on our campus, we required that all students moving into our residence hall have a negative COVID-19 test right before moving in. And as you heard earlier, the majority of our students were able to do that before coming to our campus. We knew that some were having problems getting the testing that we had required, and so we did set up a testing site on campus, and we were able to test almost 1,500 students, and as you heard, we found 16 positives. And those students were instructed to return home, to isolate, and then to get a PCR test to confirm the rapid antigen test. We are telling our university community that testing is going to be more important than ever. And so our expectation is that everyone, regardless of vaccination status, will test periodically throughout the fall semester. Our recommendation is that they try to do that at least every 2 weeks. We're also going to continue our random, proactive testing of the university community. So every week, we will take a large sample of our faculty, staff, and students, send them a notice, and instruct them to get tested for COVID-19. We have free COVID-19 testing on our campus. And so it should be easy for them to do that. We also have additional testing sites right off of campus that provide free testing as well. So the testing piece is going to be really important for us. And then finally, I'll mention that we're going to emphasize the importance of reporting to Bobcat Trace. Bobcat Trace is a reporting tool that initiates contact tracing. Now, the university has its own contact tracing team. And we believe that that's a really important tool to prevent the spread of infection on our campus. The contact tracing team is a trained team of professionals whose goal is to contact positive cases within 24 hours to begin an investigation and to determine if there were any close contacts, to determine if there are any other actions that might be needed, whether that's in a classroom, a department, or in some other area. And so contact tracing is really important. What we discovered through our contact tracing last academic year, and we contact traced over 2,000 cases, what we discovered is that people were not getting infected on our campus. They were getting infected out in the community and bringing the infection to our campus. And so we know that the learning environment on our campus is safe. We know that if we all adhere to the health and safety measures, we can have a safe learning environment. And so the university has done its part. We're ready. I think if everybody else does their part, we can be safe and we can have a successful fall semester. So I'm going to conclude my remarks there.
Thank you, Dr. Cronco. We are going to open the floor now to questions from the media. Since we're all on screen and not in person, it's going to be, logistics are a little more complicated. But if when you ask your question, if you could address to whom your question is going to, that would probably speed the process. And I'll open it up. Who has the first question?
Hi there, Jayla Washington with KXAN. Thanks so much for inviting us to be here today. My first question is directed to Dr. Cronco. I want to just talk a little bit about what you just mentioned regarding randomly selecting students, faculty, staff to get tested. So I'm just curious how that works exactly and whether or not they'll be able to refuse getting a test if for whatever reason they don't want to.
Yes, so we've been doing proactive random testing for a year now, and it has been a really helpful tool. What we have found is that many of the faculty, staff, and students that get the notice will go and get the testing done. We can use that information to assess the incidence of COVID-19 on our campuses, and we can use that information to help inform our operational decisions at the university. And so it's turned out to be a really effective tool for us, and we expect that to continue to be the case as we begin the fall semester.
So you guys haven't come in contact with, notifying somebody that they're being randomly selected and they refuse to get tested? And I mean, if they do that, are there any consequences? I mean, how do you keep track of who's actually doing it and who's not when you randomly select them?
Right. So they are not required to test, but what I can tell you is that many of them do test. And for us, the key issue here is that we get enough people testing, that we have a large enough sample every week that we can look at the data and actually make decisions based on that data because we believe it's representative of what's happening on our campus.
Thank you.
I can go next.
Kate has a question.
I'm Kate with the McGee with the Texas Tribune. So I wanted to just clarify something first, and I think this is for Jean. So there are 6 contact hours that faculty who are teaching in person can decide if they want to switch online throughout the fall semester. So they can start to do that for the first 2 weeks, let's say, of the semester, or they can hold on to it and use it in November.
That's correct. I mean, and again, very technically, it's a little bit in the weeds, and our faculty have sort of relished getting in the weeds over this one. But, as opposed to some of the other universities that mandated that all instruction would be virtual for the first, second, and or third week, Texas State decided not to do that, and instead we're relying on the existing discretionary ability by faculty to offer at least 85% of a face-to-face class in person. So again, if you think we've got 45 contact hours, if it's a 1-hour class, right, across a semester, you do the math, multiply that times 85%, you roughly come up with 39 of those hours then must be delivered in person, which would leave at least 39 hours, which would leave those 6 hours. And so indeed, Kate, a faculty member could decide beginning this Monday, if they were offering a 1-hour Monday, Wednesday, Friday class beginning at 10, they could Zoom that class for the entire first week. Of course, I would really encourage them, and I would expect them then to make sure that their students understood right now, actually before the week started, that the first week of classes for them would be offered virtually or via Zoom. A faculty member could do the same thing in week 8, 9, or 10. Faculty members often go away on academic conferences. And so this is basically one of the methods by which when they do go to a conference, if they don't have someone else stepping into the classroom and actually delivering the class in person for them, or if they're not actually Zooming in from somewhere else and the students are in person, they have that discretion to then deliver that material and those assignments in that fashion.
Okay, and then I guess this is for Dr. Karanko. So you mentioned a lot of different things that are being emphasized: vaccines, testing, reporting. Is there anything along those lines that is required? Like, is there any required testing beyond the students who were tested to come back into the dorms? Do they have to, if they get a positive test, it's emphasized that they report the positive test? It's not required they report the positive test? What is like mandated this fall for students that they have to follow regarding COVID?
Right. So for students moving into the residence halls, obviously that was mandated, it's required. And we did that because we know from past experience and scientific data that it is in the household that we see a lot of the transmission that occurs with COVID-19. It occurs within households, within friend circles. That is where the highest risk is. It's not in the classroom. It's where people live. It's where people interact with friends and family. For that reason, we made it required that our students produce a negative COVID-19 test before moving in. For everything else, it's recommended. We instruct faculty and staff to do these things. Not everyone will do it, but enough folks will do it that we can still obtain very reliable information from the testing that we're doing. And I can tell you that we operated under this kind of approach all of last fall and spring. And as I mentioned earlier, we were successful in being able to do in-person teaching both fall and spring, and we didn't have any outbreaks on our campus. So we know this can work.
Right, but I think the big difference between last year and this year was that there was a mask mandate in place. So people had to wear masks in a classroom and they had to wear masks on campus. So without that mask mandate in place, without the vaccine mandate in place, because you guys can't do that, and the full return to campus, you mentioned that the 6,000 students had to prove that they had tested negatively, but there are 38,000 students at Texas State. What are you guys, I just don't know how you guys are so confident that you can be so safe, given that there are so many unknowns and this surge that we're kind of living through right now.
Yeah, you're correct. It would be a lot easier if we could mandate things like the wearing of face masks. But as you know, as a state entity, we are prohibited from being able to do that. So our next best option is to really educate our community about how effective face masks are, and to get them to understand that if they want to have an in-person experience this fall, everybody's got to do their part. And a very important part of our strategy is that everyone wear face masks indoors. I can tell you that our past experience with our students is that they tend to adhere to the instruction and the guidance that we provide. They want to have this experience. They've been waiting for it. And so I think that if we continue to educate our community and continue to show them how important this is, that we can have success. But you're absolutely right. The only way we can ensure success is if everybody does their part. And so that is the challenge ahead of us. And we're working very hard to try to make sure that the majority of our students, if not all of them, are doing what needs to be done to be safe.
And this is my last question, then I'll let others answer. But is there, given that you can't mandate any of these vaccines or masks and are not requiring or mandating the testing and reporting, is there some kind of threshold as to Texas State getting a certain positivity rate or number of cases among students on or off campus that will force you to change how this in-person fully open semester is planned at this point?
Yeah, absolutely. From the very beginning of the pandemic, we have been monitoring a variety of indicators to help us make decisions about operations. And so we do look at a lot of different things, including case counts, hospitalizations, the ability of the university to deliver its services, the availability of isolation and quarantine space, case counts and positivity rates on our campus. We're looking at all of that every single week. And what I can tell you is that over the course of the pandemic, what we've seen on our campus is that positivity rates have been significantly lower than the positivity rates in the surrounding communities. And I think that's real. And the reason it's real is because the health and safety measures were very effective and people followed them. And so we had real lower transmission levels on our campus. We continue to monitor all of those things. We're fully aware of the fact that case counts have gone up and that hospitalizations have gone up. We're fully aware of that. And so what we're going to be doing is watching very carefully what happens in the first week or two of classes. We'll be looking at case counts. We'll be looking at positivity rates. We'll be looking for evidence of transmission in classrooms or in residence halls or in departments. So we'll be looking at all of those things. And we've been doing that for over a year now. We have structures in place to be able to do that. And so we will look at that information very closely in the first week or two. And what I can tell you is that the university has a track record of adjusting its operations whenever the conditions warranted. We've done that in the past. We'll do it again. As the provost mentioned, the faculty already have a tool available to them that allows them to adjust their teaching method. And so they have that available to them. But I think that if we see something going on our campus that really concerns us, then I can tell you that we will make adjustments.
You don't have a hard number as to cases or positivity rate that would.
It's hard to do because, as you know, this pandemic is an evolving situation, and a number today might mean something different a week from now. All I can tell you is that we carefully consider all of those indicators every single week. I meet with President's Cabinet every week. We review the data every week, and we make those decisions. And we will continue to make decisions for the benefit of the health and safety of our community. We don't want to put people at risk. People want to have this in-person experience. We've set out a way to do that safely. And if we find that things are not working as we had anticipated, we are going to make adjustments.
Thank you, Dr. Karanko. I believe Fred has been waiting to ask a question. Mr. Cantu, you're up.
Yeah, and I guess it's also for Dr. Karanko, because I was wondering, you're talking about building on the successes of last year, but what about the variant? I haven't heard mention if you've made any adjustments because this new variant is more contagious than what we were dealing with last year.
Right. So you're absolutely right. It is more contagious, and I think that there are two things that you can do that would have the most benefit, and that is to vaccinate and wear a mask. Masks work. It doesn't matter about the variant. Yes, the variant is more contagious, but a good face mask that is properly fitted to the face can be very effective in reducing that risk. And I think vaccination, as we know, continues to be very effective in preventing those serious outcomes. So those two things are very important. And I think that the contact tracing, again, becomes really vital to our effort, because if we can identify those positive cases very early and we can get to the close contacts, we can break the chain of transmission. And so I do think that even with those existing measures, that we should have some success even against the Delta variant.
And I think Dr. Bourgeois mentioned earlier 100% occupancy would be allowed at venues. And ACL just announced a few minutes ago that they're going to be requiring vaccines for their festival. Is there any talk of requiring vaccines or what is it, proof of a negative COVID-19 test when we have these gatherings on campus in larger venues?
I'll respond to that. Not yet, not at this point. I think what we're saying is that wherever it's possible, we do want to create some additional space at our events. We're trying to do a lot of events outdoors, and again, really advocating for vaccination and the use of face masks, especially for indoor events. You know, the nature of the event really matters. And so if you look at the classroom setting, people are generally seated and generally listening to a professor. And we know that even 3 feet of separation provides a significant reduction in the spread of COVID-19. And so we're still trying to work within these 12 health and safety measures and encouraging event planners to try to create as much space as they can. That will be possible in many venues and difficult in others. But again, I'll go back to what I said, is as we review the situation weekly, if we see problems developing, we will adjust our operation. We will adjust what we're asking people to do on our campus.
Thank you.
Thank you. I believe Megan with the Austin American Statesman had the next question. Megan?
Yes, hi, can you hear me?
Yes.
Yes.
All right, so my question is, a lot of schools, including some in Texas, have announced vaccine incentives for students, so whether that's hundreds of dollars off on tuition or even a lottery for free tuition. And I was wondering, you know, a lot of you have, you know, kind of spouted how vaccines are important to stop the spread of COVID. I was wondering if Texas State has plans to incentivize vaccinations beyond asking students to get vaccinated.
I think I'll take that one. We've sought guidance from our Texas State University System Office, and the guidance that we have received is that we will not be pursuing any kind of incentives for vaccinations of our faculty, staff, or students.
And one more question, can I ask why that decision was made or what guidance prompted that decision?
The queries went in through our Office of General Counsel, again, at our system level office, and that guidance that came back said that as a state agency, per their understanding of the governor's executive order, that we would not be allowed to do incentives for vaccinations.
All right, thank you.
Okay, I believe Jayla has the next question.
Yes, just a couple of follow-ups for you, and I hate to keep comparing you guys to other districts, but obviously we're all watching very closely what's going on. Was just curious if you guys have any formal process to track students, faculty, and staff that are or aren't wearing masks. So for example, one school district, they're having parents either opt in or out. Obviously, some are requiring them, but the governor is saying you can't mandate it. I'm just curious if you guys are trying to get a sense of who is wearing masks on campus.
I'll start. My colleagues can add, but I think they're going to say the same thing. It's been made very clear to us that we cannot require the wearing of face masks on our campuses, and therefore we are not requiring that, and we cannot actually monitor or otherwise sanction those who are not wearing face masks on our campus. And in fact, I've really tried to impress upon faculty members through written communications primarily, and through the town hall that we had 2 days ago now, I believe, that they need to be very careful in terms of even suggesting that they are requiring students to wear a mask in a class, so that they are basically segregating students who are wearing masks and those who are not wearing masks, or anything else that basically calls attention to someone who's not wearing a mask.
So do you guys have any insight on enrollment being down this semester compared to this time last year? And are there any, I guess, specific programs related to the pandemic that will help tend to students' needs who maybe are out because of testing positive?
So as of this morning, and I know I'm doing this with a lot of my press colleagues here, and I'm jumping the gun on my president, but I'm pretty certain that we're going to have a record freshman class this year at Texas State University. And that would be up significantly over last year. So if I'm wrong, it'll get blamed on me. I accept the blame, but it looks like we're going to have a record class. The record class was set in 2019. Overall enrollment looks like it's going to come in right about the same as it was last year, but we were down significantly in freshmen last year, and we've graduated more students in the past year. So actually, we're looking very good in terms of enrollment for this fall, and actually building the base for continued enrollment increases in the future. And I personally believe that one of the reasons why we're seeing a strong enrollment surge right now is because the university has dedicated itself with its faculty, staff, and students to as much of an in-person experience for them as possible.
I just want to jump in right quick for our media friends that we will have official enrollment numbers after the 12th class day of the semester, which I believe this year is September 14th. So we'll be able to address your questions as far as enrollment goes with certainty after the 14th of September.
So you'll be able to see if I was right or wrong, basically.
Yes.
Sounds like a plan. And then do you have any sense of whether or not you guys have specific programs, related to the pandemic to help students out who might be, down and out just because they did test positive for COVID-19?
I can speak a little bit to before the pandemic and during the pandemic. Obviously, the conversations around well-being and mental health of our students have been front and center. And so we continue to invest resources and have some priorities around expanding our contact hours in our student counseling center, our counseling center here on campus. Also continuing to offer multimodality of interacting with counselors as well to assist students and to reach more students where they are. So we're pretty excited about that. One of the other things that Dr. Bourgeois has been talking to the faculty about is how we handle students who may be absent from the classroom because they are serving, they need to serve out their isolation or quarantine parameters. And so we've been working at reintroducing really our existing system for absence notification and for students being out due to illness. And really making sure that the faculty understand and know how to utilize that. And then we in turn on the student end will continue to do that as students reach out to us through our Dean of Students area and through our care center in our Dean of Students area. That's one of the things we've been working on. We just spoke to a good handful of new faculty coming in to remind them of the services that students have to support them if they are being impacted by the pandemic.
And
Thank
also,
you guys so much.
I'd also like to point out that we have $40 million in emergency grant aid that are available for students. I will send a link to the release out to our participating media friends right after the conference here concludes.
Yes, I was going to mention that as well, that financial support is available through the Dean of Students office. I would also say that while we're asking students who test positive to go home to isolate, for those that cannot, we're providing spaces on campus. And so international students, out-of-state students, or students that might have an immunocompromised family member at home, we certainly will try to support those students with some on-campus isolation or quarantine spaces. I can tell you that at the Student Health Center, we will continue to provide both in-person services as well as telehealth services for our students. We do not deny healthcare to anyone because of inability to pay. So when our students need healthcare, they'll be able to come to the Student Health Center and we'll take care of them, whatever that means. So I think our students really have a lot of different support resources on our campus. We've used some of those already. And I think the students have really appreciated that. We'll continue to do that as the fall semester unfolds.
Thank you.
I believe Kate had a hand up for a follow-up question.
Yeah, thank you. I just wanted to go back to the questions that Megan was asking about the vaccine incentive. Do you know what the Systems General Counsel's office is basing that interpretation of the government? What in the governor's order says that they can provide incentives, or given that other schools, public universities in the state are also doing that and they're under the same order?
Yeah, no, I'm not aware and haven't been privy to any of the other reasons or rationale why Texas State University could not do that, other than we will not be pursuing incentives.
Okay, thank you. Tamia, I believe you have the next question.
Hi, I'm Tamia Cobb from the University Star, and my comment is related to Dr. Karanko. I just wanted to know, could you give more information about in the upcoming week, how there will be vaccination boosters for both Pfizer and Moderna for immunocompromised persons, and exactly how they will be able to receive these vaccinations, and also if those who are getting vaccinated, will there be like a estimation of how many are getting vaccinated from the group of immunocompromised persons? Sorry.
Okay, so what I would say is that, first of all, we've been providing vaccinations to the university community since March. And we continue to do that. Vaccines are available at the Student Health Center Monday through Friday. All it takes is a phone call. You get an appointment and you're able to come in. We're currently offering Pfizer and Johnson & Johnson vaccines. We are going to add Moderna. And we're doing that because we're aware that booster shots have been authorized, initially for the immunocompromised. And that number is really pretty small. About 3% of the adult population in the United States meets the criteria for a moderately to severely immunocompromised person. People who have cancer, people who are undergoing chemotherapy, people who are post-transplants, organ transplants, and people who are receiving high-dose steroids or other medications that suppress the immune system. So that's a small group, but we're aware that some of our community members received Moderna at other locations. And so we are preparing to be able to offer both Pfizer and Moderna boosters. The Pfizer booster will be available next week, and I'm hoping that Moderna will be available the week after that. There's also hinting now from the FDA and the CDC that boosters will probably be recommended for everyone at 8 months after their initial series. As soon as that is officially approved by all the different bodies that have to review that recommendation, then of course we will plan to provide booster shots for everyone, regardless of where they got the vaccine initially. So we believe that the vaccination effort that we're going to have to put forth this coming year will be significant. Our intention is to have Pfizer, Moderna, and Johnson & Johnson available. We'll do it through the Student Health Center, but we're also going to have mass vaccination events every week. We're having one of those events this Friday, targeting the first-year students that just moved in this week. Classes, of course, begin next week, and so we will continue with another mass vaccination event next week, and we'll continue doing those every week until we feel like there's no longer demand for it. So vaccinations are clearly one of the things we're going to advocate for very strongly. It is the best way to protect yourself. I try to remind everyone I talk to that COVID-19 is not going away anytime soon. It will continue to come back. And so it's important for everyone to have some level of protection so that if you are infected, you have a decent chance of being able to fight off the virus.
And my next question is, I believe it was in June or either early July, you gave an estimation of either 15 to 20% of students have been tested at the university. Do you feel as though that has changed as of now?
So you're asking about testing or vaccination?
I'm sorry, vaccination.
Okay. Well, you know, universities didn't have access to vaccines until March. And even in March, we were being instructed by the Texas Department of State Health Services to target certain groups of people. And by the time all college students were able to have access to the vaccine, we were already into April. And so unfortunately, because of the timing, we didn't have a great opportunity to try to vaccinate a lot of our students. That said, we still vaccinated 6,000 people. We've vaccinated 6,000 people so far, and we've delivered almost 11,000 doses of vaccine. We know that a lot of our community got their vaccinations elsewhere, especially in the early stages for folks who were elderly or immunocompromised. And so we don't have complete data at the university for that reason. We know folks got their vaccinations at many other places. And so I can't give you a good number. What I do is I look at the vaccination rates for our surrounding counties. I look at the vaccination rates that the CDC publishes for certain age groups. I use that information to try to get some sense of where I think vaccination levels are for the different populations that will be coming to our campus. And that's about the best that I can do right now, especially since we're also not permitted to ask about vaccination status.
Thank you. And the next question I had, for whoever can answer it the best, regarding the Bobcat Cares COVID-19 grant, during the last semester, as in spring semester, there was 2 rounds of the grant that went out. And I was just wondering who exactly qualifies for it, seeing that some students didn't get it the first round. And while the grant has came out before, there's never, or what I'm aware of, there hasn't been 2 rounds, but due to students getting it before and wondering why they didn't get the grant this time, was it a possibility that the grant came out a second time due to some students that thought they qualified not getting it?
I'll start, and then I'll have Jamie and then Sandy, who's also sending you all information. You can see basically what she sent was what we currently have in terms of guidelines for this next round. To me, it could have been that we actually put more money into the pot in the spring, and that's why we might have run a second round. But the intention this fall is to award roughly up to about $40 million effectively in 1 round. In other words, there's no plan to have 2 rounds. And so I think that's why this summer even we began to publicize the fact that we would have this round of CARES emergency grant funding this fall, so that current students who would still be enrolled this fall at the eligibility date, and then incoming students who would be enrolled at the eligibility date would all have as much information ahead of time to know that they can plan to apply for those funds. Again, pending their enrollment on that eligibility date.
Okay, we are running up against time. We have opportunity for Megan to get one last question in, and then we are going to, excuse me, I apologize for that. We're running up against time. One final follow-up question from Megan, then we're going to have to end the conference because I know our speakers have quite a few other obligations today. So Megan, if you could make your comment, question, thank you.
I wanted to kind of, similar question to what I asked earlier is, does the university believe that they can ask, students can submit their optionally submit their vaccination status? So tell the university, hey, I'm vaccinated, by submitting their vaccine card, even in an optional way, will the university be soliciting the vaccine information of students?
I'll try. Well, to date, we have not set up any mechanism by which, even if students presented that vaccination status, we have not set up any system to track or monitor that.
Okay, thank you very much. I think that will do it. I appreciate all the media for participating. Thank you for our university representatives, and I will be sending out the link to the recording of this conference as soon as it is available from Zoom. So you may be looking forward to seeing that later this afternoon. Thank you, everybody, and have a fantastic day.
Hey there, everyone. Will Dupree once again in the KXAN live studio. We've reached the end of that conference that was called by Texas State University. 3 different officials really speaking about how this new semester is going to unfold related to COVID-19. Since the pandemic is far from over, there at the end of it, Dr. Karanko, who is the chief medical officer for the university, stated that there will be mass vaccination clinics held on campus every single week to offer the shots to students and other staff members on campus if they have not yet gotten it. However, vaccination is not required. For instance, that is because Governor Abbott and the state legislature put that into law, that universities, which are public universities, I should say, which are government entities, are not allowed to have vaccine mandates. Additionally, there will be testing done throughout the weeks of this new semester. They're going to ask that faculty, staff, and students be a part of this kind of collective, proactive testing so they can go and get a test and submit that, and then the university will use that voluntary information to make some other decisions related to how they conduct business on campus. The only mandate that was put into place at Texas State was that those moving onto campus and fairly recently had to provide proof of a negative COVID-19 test, and if they did not have that with them, there was rapid testing available through the university. 6,000 or so moved onto campus there and provided that, and about 1,500, they said, did not have that proof of a negative test, so they did it on campus, and only about 16 positive cases were identified there. So that's about 0.2% of those who moved onto campus. The university is encouraged by that particular number, but they're going to continue to monitor the situation, as are all school districts and universities. You may have seen Jayla Washington, our reporter. They're asking several questions of the officials today. She's going to work on putting this story together for our later newscast. She'll also update our web story on kxan.com, so check it out if you have any other questions. We'll also include portions of this video. We'll clip that and put it in the story as well so you can watch it too. Thank you all again for watching. I'm Will Dupree here in the KXAN live studio. We'll see you back here at another time. Please, everybody, stay safe and healthy out there. Take care.